COVID-19 partial lockdown in Tamil Nadu. From April 10th, Tamil Nadu reintroduces restrictions with partial lockdown. The Tamil Nadu government reintroduces multiple restrictions from April 10th to tackle the steady increase in COVID-19 cases across the state. The restrictions have been brought back as campaigning for the state assembly elections and the voting has been completed in the state. Tamil Nadu recorded 27,743 active cases as on April 7th yesterday. The restrictions will be in place until further orders. All religious places or places of worship will be permitted till 8 p.m. by strictly following the standard operating procedures issued by the government in August last year. There will be a ban on international flights except those allowed by the Ministry of Home Affairs, temple festivals, and religious events, small traders at Coimbatore wholesale market and small retail traders in all the districts. There will be no relaxations in containment zones and they will be under total lockdown. Also, private and government buses plying between districts in the state and MTC buses in Chennai will be operated only with seated passengers. No standing passengers will be allowed. Buses plying between Tamil Nadu, Puducherry, Andhra Pradesh, and Karnataka will operate only with seated passengers. Fruit and vegetable shops, grocery, and other stores, shopping malls, all retail showrooms, jewellery shops, big stores will be allowed to operate only with 50% capacity at any point in time till 11 p.m. Retail outlets in Coimbatore wholesale vegetable and fruit market in Chennai and whole vegetable and fruit markets in other parts of the state will not function. Restaurants and tea shops with seating will be allowed to function only with 50% capacity at any point in time till 11 p.m. Restaurants will be allowed to provide parcel service till 11 p.m. Recreation clubs can function only with 50% members. Besides, entertainment parks, amusement parks, large halls, zoos, parks, museums can function only with 50% capacity. Multiplexes, cinema halls in shopping malls, and stand-alone theaters will be allowed to function with only 50% seating. Social, political, educational, recreational, sporting, and cultural events in indoor venues will be allowed with a maximum of 200 persons. Weddings can be conducted with a maximum of 100 guests. Funeral processions or last rites are allowed with a maximum of 50 persons.
Sporting events in indoor and outdoor stadiums are allowed to be held without spectators. Swimming pools, sports training allowed after following necessary protocols. Business-to-business process exhibitions will be allowed in exhibition halls. Allowed only for business-to-business purposes. Television serial and film shootings will be allowed, but production houses must ensure that everyone on the sets take RT-PCR tests or are vaccinated. The management of industries, shopping complexes, private organizations, offices, and restaurants shall ensure thermal scanning, use of hand sanitizers and wearing of face masks by their employees, officials, and public. Persons without face masks shall not be allowed to enter the premises. Industries will be permitted by strictly following the standard operating procedures. The establishments shall arrange for vaccination of their employees based on the guidelines issued by the center, and stern action would be initiated in case of violation of SOP. Rental taxis and cabs can operate with a maximum of 3 passengers apart from the driver. Autorickshaws can carry a maximum of 2 passengers apart from the driver. The e-registration system for those coming to Tamil Nadu from other states, except from Puducherry, Karnataka, and Andhra Pradesh, or countries will continue. A monitoring committee will monitor the implementation of these restrictions. Ground-level monitoring committees will be formed to assess the ground situation. Such teams will be formed across all the districts. Advisory from the government has been issued for those above 45 years of age to get vaccinated at government-run vaccination centers, hospitals, or private hospitals within the next 2 weeks. The Union Health Ministry on Thursday said 10 states including Maharashtra, Chhattisgarh, Karnataka, Uttar Pradesh, Delhi, Madhya Pradesh, Tamil Nadu, Gujarat, Kerala, and Punjab have shown a steep rise in the daily COVID-19 cases, accounting for 84.21% of the 126,789 new infections. India registered a record single-day spike of 126,789 new coronavirus infections, pushing the nationwide COVID-19 tally of cases to 129,28574, according to the ministry data updated today. Maharashtra has reported the highest daily new cases at 59,907. It is followed by Chhattisgarh with 10,310, while Karnataka reported 6,976 new cases. Reports The Hindu, The Mint, and The Times of India.
About coronavirus. Coronaviruses, COV, are a large family of viruses that cause illness ranging from the common cold to more severe diseases such as Middle East Respiratory Syndrome, MERS-CoV, and severe acute respiratory syndrome, SARS-CoV. Coronavirus disease, COVID-19, is a new strain that was discovered in 2019 and has not been previously identified in humans. Coronaviruses are zoonotic, meaning they are transmitted between animals and people. Detailed investigations found that SARS-CoV was transmitted from civet cats to humans and MERS-CoV from dromedary camels to humans. Several known coronaviruses are circulating in animals that have not yet infected humans. Common signs of infection include respiratory symptoms, fever, cough, shortness of breath, and breathing difficulties. In more severe cases, infection can cause pneumonia, severe acute respiratory syndrome, kidney failure, and even death. Standard recommendations to prevent infection spread include regular hand washing, covering mouth and nose when coughing and sneezing, thoroughly cooking meat and eggs. Avoid close contact with anyone showing symptoms of respiratory illness such as coughing and sneezing. Reads the Tamil Nadu government website of the Ministry of Health and Family Welfare.